this miracle, this scientific breakthrough. Professor of Parasitology and Global Health and Dean of the Faculty of Allied Health Sciences at Kwaku Nhyira University of Science and Technology, Professor Alexander Yaw Debrah. Prof, good morning and thank you for joining us on the Asaase Breakfast Show.
Yeah, good morning. Can you please hear me?
Yes, we can hear you loud and clear, sir. And happy to be talking to you this morning. Congratulations. Growing up, one of the things that words or diseases that we learned about and we sort of liked to mention is elephantiasis. But I can guarantee you that not a lot of people know what elephantiasis is. Would you please start, before we get into what you did to find this cure, tell us what this disease is and how it impacts us as a people?
Okay, thank you very much and good morning to your listeners. Yeah, so elephantiasis is one of the diseases called neglected tropical diseases. In Ghana here, it is found, it used to be in 98 districts, mainly along the coast of Ghana, in the northern part, upper east, upper west, and northern region, and also some areas in central region. Normally, it is caused by mosquito. When a mosquito bites an infected person, it picks the baby worm. And then when this mosquito bites another person, it introduces the baby worm. And then the baby worm will grow to become adult worm. And in the course of, the lifespan of the worm, it will cause blockade of the lymphatic vessels. So there's no to and flow movement of the lymphatic fluid. So they will accumulate in where the adult worm is. And then it will lead to, swelling of the legs, which will eventually lead to elephantiasis. That's if the adult worm is found in the leg. And if the adult worm is found in the scrotum, it will lead to what is called, hydrocele, which in local term we call it echo, So elephantiasis is actually caused by, mosquito. When we are bitten by mosquito and then the parasite is introduced into you, then you have it.
Wow. Now, we take mosquito bites for granted in this country. In fact, we've come to the point where we sort of have accepted we live with mosquitoes. But never did I know that it could be very, very disturbing. How did you set about to finding and arriving at this permanent cure for elephantiasis?
Please, your question again.
How did you set about to arriving at the point where you now have found a permanent cure for the disease, elephantiasis?
Okay. Actually, I've been working on this elephantiasis work for the past 26 years. So after my bachelor education from KNUST, I happened to join a group from Germany who had then established Kumasi Center for Collaborative Research, into tropical medicine. So their first work was on onchocerciasis, which I was part of, river blindness. This is a disease which afflicts, those living along the banks of major rivers like Ofin, Pra, etc. And then later on, we moved to the western region to actually work on, elephantiasis. Elephantiasis is the advanced form of the disease. Actually, the normal name is, lymphatic filariasis. So when we went there, actually, but then they hadn't started mass treatment where everybody is treated. So we went to a lot of communities and we saw people with enlarged legs, swollen legs, some with wounds, sores, ulcers around it, they were so stigmatized. And then the question is, as a young scientist, what can I do to help, So that's how the whole thing started. When I saw these patients with elephantiasis of the legs, and there was no help coming from anywhere. And then I had that passion to actually help. So that's how the whole thing started.
So this is how you were inspired to start research on filariasis and all these neglected tropical diseases. Now, can you walk us through the moment or the discovery that marked the turning point in your research on elephantiasis?
Okay. Actually, there is a drug called ivermectin, which is used to treat elephantiasis. It's called ivermectin or metazam. This is a very potent drug. When a patient takes it, it kills all the baby worms in the blood, but it has no effect on the adult worm. And the adult worm can live for up to 15 years. So it means if a person is infected with lymphatic filariasis, that person will have to take ivermectin for many years, as long as the adult worms live, So it's pathetic if a patient comes to you, that patient is infected, and you tell the patient, you have to be taking this drug for the next 10 to 15 years. So again, we ask ourselves, how can we help? And that was the time on it. Still, pharmaceutical companies have stopped researching into finding new drugs for these neglected tropical diseases. Why? Because there is no commercial value. So we in the field say, how can we get a drug that can kill the adult worm so that a patient takes it once and for all? These are people, I'm talking of people who have the infection but have not developed the disease, which is the elephantiasis, so that we can prevent these people from getting elephantiasis. So we went back to the literature. We saw that, a professor in America about 30 years ago found that when you take some of the filarial worms, like those that cause elephantiasis and river blindness, he saw some bacteria, another organism within the worms. He reported it, but he said yes, and so what? And that was the end. And then when we were looking for a drug that can kill the adult worm, and pharmaceutical companies were not ready to research into finding new drugs, then we said, okay, why not kill or use a drug that can kill this bacteria within the worm and see what happens. So we treated patients, with antibiotic, not necessarily killing the, parasite, but just to deplete or kill this bacteria within the worms. And when we depleted or we killed this bacteria called the endosymbiotic bacteria or bacteria, we saw that after 1 year, the adult worms were not able to survive. So they died. And that was a big breakthrough, because the drug that we use, this antibiotic, are very cheap drug, affordable in all endemic, countries. Therefore, it means the patient can afford. So that's how come, we came by this drug. So it is not a new drug. It is an old drug that we repurpose, to kill the adult worm. So it means if a patient or somebody is infected, if you go to an endemic community and for a funeral or for a wedding and you are infected, you don't have to take ivermectin for 15 years. You take this drug, antibiotic, for 4 weeks, and it kills the adult worm, and you become free forever.
Wow.
So that was the first part, to treat the acute phase. And then most often people move from the acute phase to the chronic phase. That's when they develop the elephantiasis. So we said, we did, genetic analysis. During my PhD work, I went to Germany, it was just to find out why is it that in the same endemic communities, just a very few people develop elephantiasis and hydrocele, even though most of them are infected. And during my PhD work, I found that, well, it has genetic propensity. Those who develop elephantiasis and hydrocele are people who, overproduce some growth factors. But when the worms are moving, they cause damage to your lymphatic vessels, and you need to produce these growth factors to repair the damage. But in some people, they overproduce these growth factors, and as a result, they develop elephantiasis or hydrocele. So having found that in my PhD work, then the next question is, how can we reduce or how can we treat these patients by reducing these growth factors? And we saw that the same antibiotic that we use to kill the adult worm, can be used to reduce these growth factors. So we tried, and lo and behold, those with elephantiasis, early stage of elephantiasis, had improvement in their legs. So that's how come we saw that this new drug, even though it's not a new drug, it's a repurposed drug, is able to kill the adult worm so that patients do not develop elephantiasis. And if they start developing elephantiasis, that's the early stage, the same drug can revert the elephantiasis.
Wow. Now, this is a great breakthrough, but I need a little extra education. How does this differ from the previous treatment or the management options for the disease?
Okay. As I said, we have two forms of the disease, the acute phase. When the patient is infected, the adult worms are there, they are producing, and if you don't kill the adult worm, then the patient will move to develop elephantiasis.
Right.
And then the chronic phase.
Okay.
So in the acute phase, the current drug for treatment is ivermectin.
Okay.
As I said, it's a very good drug. It kills all the baby worm, but has no effect on the adult
worm. Okay.
Yes. So it means the person, even though if you take it, it will kill the microfilaria or the baby worm. It will stop spread of the disease, but the patient may still develop elephantiasis because the adult worms are there. But this new drug, the antibiotic that we have found, will actually kill the adult worm, so the patient will not move ahead to develop,
elephantiasis or even graduate beyond the acute phase.
Yes.
Now, when
and then if the patient has developed elephantiasis, the ivermectin has no effect, in improving the condition. But in the early stage of elephantiasis, this drug can, revert the elephantiasis.
Wow. Now, the cure, this antibiotic that you've discovered and repurposed for the cure, leads me to ask, at what point does the infection develop? So when the mosquito transmits the worm, is it a fully grown worm or the baby worms that is transferred from an infected person?
It's the baby worm. When mosquito bites an infected person, it will pick the baby worm.
Right. No, so how long does it take for a baby worm to fully grow in a host?
Well, the baby worm, even within the mosquito, the baby worm will actually move twice to become from L1 to L3. That will take about 2 to 3 months.
Okay.
It will become L3. And then it is the L3 that is introduced into another person. And it takes about 6 to 12 months for this L3 to grow to become the adult worm.
Wow.
And it is this adult worm which will actually cause, the elephantiasis.
Now, this is good news coming out of Ghana, and it makes me very proud. How are we looking to take this to places like Tanzania and Cameroon, where elephantiasis continues to give them great headache?
Okay, yes. I think there is a consortium called, Takeoff, tackling the obstacle to fight filariasis, which is found in Ghana, in Ghana, Tanzania, and Cameroon. And I'm the director of that consortium. So our aim is to actually tackle the obstacle that, affects the treatment of filariasis. And one of the things that we are doing currently in Ghana, for instance, there is a district in Ghana which, we didn't know there was an LF, but I'm sure due to migration and others, LS have been, established in this district. So the Takeoff consortium, for instance, as I talk to now, we are in this district trying to test almost everybody in the district, and those who have the infection but have not developed the elephantiasis yet, we are going to treat them with this, new drug so that they don't go ahead and develop elephantiasis. And we are doing the same thing in Tanzania, Ghana, and, Cameroon. So if you want to know what is being done in this country, actually, this is what we are doing. We are doing many things, one of them is what I've done. I've said that, you are looking for people who are infected in these new districts, who have not yet developed elephantiasis. We treat them with this new drug so that they don't go ahead and develop elephantiasis. And then the Takeoff consortium, again in Ghana, Cameroon, and Tanzania. We are giving training to nurses, community health volunteers, and then, patients as to how to, keep the leg, clean so that they don't develop the elephantiasis, doesn't, get worse. And then we are establishing elephantiasis management clinic in some of the endemic communities. So in Ghana here, for instance, this year we've established 2 elephantiasis management clinic, one in the Kassana East, that's in the Navrongo Hospital, and then another one in Kassana West District, where people who have elephantiasis can go there, have treatment, free of charge. So this is what we are doing in Ghana, Cameroon, and Tanzania. Thank you.
Wow, fantastic work. And my final question has to do with scaling such a cure up. What would it take? Is there any policy that's required to scale this up to the point where, the treatment can go wide?
Yes. So as I said, this is an antibiotic which has to be taken for 4 weeks. So it's not meant for mass drug administration like the ivermectin is, used to do. But what we are doing in terms of policy is, as I told you, Ghana has eliminated LF from all districts except now about 5 districts, mainly true, but there are 3 other new districts. So we need to do something drastic. And I think we need to have a policy where, when we detect or get to know that there are new districts with, lymphatic filariasis, we need to go in quickly, and get those who are infected and treat them before they start spreading the disease in the community, And again, where in endemic communities like Katsina and Kana East, Katsina and Kana West, Nzima East, Ahanta West, Elembele District, where we still have elephantiasis patients, I think we need to establish lymphedema management clinic or elephantiasis management clinic so that those who are affected can go there and have, treatments. But more importantly, I always advise that we should enlist elephantiasis management on National Health Insurance Scheme so that those with elephantiasis, can have access to medical care. Most of them, because they cannot afford, when they get attacked, instead of seeking medical redress, they try to put all kinds of concussion, in the wounds, and then this aggravates the situation. So if the state can actually put these patients on, or this disease on National Health Insurance, scheme, so that they can go to hospital, and have, medical attention, that will go a long way to actually help the patients.
Right. Well, Professor Alexander Yaw Debrah, congratulations. I think that 26 years of dedication to a cause has paid off beautifully, and we're grateful to you. On behalf of this nation, I say thank you and God bless you. Thank you so much for talking to us.
But if I can clarify one thing before I leave.
Yes, sir.
Okay, so if somebody has the infection and he takes these drugs, the person is prevented from developing elephantiasis.
Okay.
In early stage of elephantiasis, it can reverse it, but in advanced stage, it cannot. So it's not a permanent cure for elephantiasis, because if it gets to the advanced stage, then of course it will stop the progression of the elephantiasis, but it cannot reverse it. So it's not a permanent cure, actually. But somebody who has the infection, it will kill it, and that person will not develop elephantiasis. Thank you.
Thank you so much, Prof, for the clarification. We're grateful for the education. And again, congratulations on this wonderful feat.
Thank you very much.
We should have you for another conversation, just to really, try and understand who you are, what your passion is, because not everyone will stick to a project for 26 years and have this breakthrough. But you stuck with it. There's lots in there for us to learn. And God bless you for the work you've done. All right. Have a good day. And that was Professor Alexander Yaw Debrah. He's a professor of parasitology and global health and dean of the faculty of allied health sciences at the Kwame Nkrumah University of Science and Technology. This is a man who a leading light in his space and has worked for 26 years and finally found a breakthrough treatment for a permanent cure for elephantiasis. These are the stories we like to hear.
Thank you for watching. Like, comment, share, and subscribe.